Hi, graduates. Thank you, Dr. Charney, for that very kind introduction, Dr. Nestler, for your insightful words. Thank you to all the faculty and staff and distinguished guests, some old friends, new friends. It's really a privilege for me to be sharing this stage with all of you, and it's really my very deep honor to be joining these classes here today. This occasion, commencement occasion, for me is always such an incredibly exciting time. There's all this sense of promise and sense of newness as graduates go out to take on new adventures and take on new challenges. And as I was preparing for this and looking at all of the things that you've been doing, I was so inspired by the range of programs and arenas that you have mastered in your time here, from genetic counseling to leadership and healthcare delivery. And you've done projects all over the globe, Africa, Asia, to the Americas, including here in the United States. And you've looked at things as broad as health and human rights to new treatments for hair growth. You've really had an opportunity of a lifetime. So I hope you leave here with a clear sense of accomplishment and really a real appreciation for what your time here has been. I also hope that you will look around and think about the relationships and the friendships that you've had, the bonds that you've formed with your fellow students and faculty and staff. These lifetime relationships are going to mean more and more as time goes by and as you navigate your life and your careers. So I hope you continue to keep those bonds. But before we go on, let's give a round of applause for these wonderful graduates and this exceptional moment. There's also another group of people to thank. They're here today because they believed in you enough to make sure that you had a chance for this wonderful education. They've been there to support you in all sorts of important ways. So before we go on any further, let's hear it for the graduates' parents, families, and loved ones. Thank you, thank you, thank you. Now, I don't want to spoil the celebratory mood, but you know there is another side to graduations. This is the moment when most of you are about to put your training into practice and go into the working world. It is totally exciting, but it's also, I'm sure, a bit overwhelming because it's not easy out there and there are lots of challenges. Today, across the country and around the world, we're seeing a deeply divided political landscape. Economic inequality is reaching levels that we haven't seen since the Great Depression. Racial and religious tensions are being manifest in very, very disturbing ways. And with all the challenges swirling around, sometimes I know it may feel easier to kind of adopt a bunker mentality. Just wait this out. Let somebody else fix it, and then stick our necks out again. But not you. You've taken an affirmative step towards action by choosing a career in health. With your new degrees and new scientific and medical advances, you've got powerful new tools to make a difference in the health arena, which means you can make a difference in the lives of people everywhere. That said, science, technology, and know-how is not enough. Even with all the advances we've made, we know we're not where we should be. We know we're not where we could be as a nation and also as a world. Here in this country, we've got the most advanced, sophisticated healthcare in the world, but we still have one of the most unequal health systems. We spend far more on health than any of our peer nations, but yet get the worst overall returns on our investments. We have the highest rates of preventable diseases among most industrialized nations. And last year, for the first time in decades, life expectancy actually fell in the United States. And that decline is linked in part to upticks in things like alcoholism, opioid use, suicides, unintentional injuries, fueled by another epidemic, the epidemic of hopelessness and despair. And as unfair as these differences are in our own country, we know that the gaps in health status are even more stark between rich nations and poor nations. These realities, and others like them, have haunted me for all of my career. Today, in the 21st century, with all we know and with all we have, why haven't we solved most of these challenges that are so central to our existence? As a nation, we have enough money to provide everybody with high-quality health care. Our technology, our science, our medical knowledge are the best in the world. We've got incredible tools today that people could have only dreamed of 5 to 10 years ago. And some of you will be creating even more powerful tools in the years to come. So this brings me to a question. Do we have the will that it takes to stand up for what is truly essential? Do we have the will to stand up for justice? Half a century ago, Martin Luther King said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." If we want equality in healthcare, we're going to have to stand up for it, and we're going to have to keep standing up for it. As an example, the recent House bill to replace the Affordable Care Act, or Obamacare, could strip at least 24 million Americans of their health insurance. It would cut Medicaid spending by a quarter, hurting many of the 74 million poor, elderly, and disabled people who rely on it. It's time that we affirm that access to health services is a right. It is as basic as education, clean water, and clean air. Access to quality health care is not, and should not be a privilege of the economically advantaged. I believe we have everything we need to meet most of our biggest health challenges today. We have the technology, we have the financial resources, we have everything but the will. We need to see the unbreakable links between health and other aspects of our society. Health and fairness and economic growth, these are all threads in the same fabric. As health professionals, we have vital roles to play in making that fabric strong. Families, schools, businesses, and of course, government officials, everybody has their part to play. If we start from a simple premise that every life has equal value, then we'll be able to find the will to demand equity in our healthcare system. Anything less than that demeans us as a nation. Now, when I was growing up, I didn't plan to be a doctor. I just knew that I wanted to do something that would allow me to make a difference in society. But I began to realize the central role that health plays in the lives of people and their communities. One of the reasons that I went from medicine to public health and then to fighting global poverty is that my work as a pediatrician taught me that the tools of health and medicine went only so far to be able to address these issues of poor health and unequal health in our country and around the world. The link between economic and social justice is core to being able to build healthy societies. We all know that communities that are economically healthy have healthier populations. Good schools help prepare people for good jobs. As employment and income rises, obesity falls, along with alcohol, drug abuse, suicide, and violent crimes. When streets are safe, children spend more time outdoors and they get more exercise. Now, I've been fortunate along my career to work with incredible organizations, the Centers for Disease Control, the Gates Foundation, CARE, all of the organizations that have allowed me to live my passion for social justice and equity. 2 years ago, I joined another great organization, the newly created McKinsey Social Initiative. There, we're harnessing that consulting firm's problem-solving expertise to develop solutions to global social issues. Our first effort is called Generation, and we're helping unemployed youth get trained and find jobs, not only here, but also around the world. So far, more than 10,000 young people have graduated from this program in the 5 countries around the world. These young people are earning a decent living, often for the first time in their lives. Imagine the difference that it makes to the health and well-being of these graduates and their families, and to the health of their communities. Now, we can become obsessed with the pursuit of a better diagnostic tool, or of a computer model, or of a newer and better treatment. Obviously, these pursuits are so important, they're necessary, very, very much worthy. But any advance that we make will be limited in impact unless we expand equity at the same time. Health is not only a matter of easing some symptoms or even curing a disease, it's also core to strengthening the fabric of our entire society. And to do that, it means that we've got to stand up for fairness, for justice, for equality. If President John F. Kennedy was still alive, he would be turning 100 later this month. He's the first president that I remember well. He inspired me. He inspired our nation and the world with his sense of the possible, with his sense of optimism. Under JFK, the Peace Corps was founded to promote world peace and friendship. The U.S. Agency for International Development, USAID, was founded to build economic prosperity in other countries around the world, and now that organization's very existence is being threatened. President Kennedy realized that when the rest of the world prospers, so does America. He also called for the passage of the Civil Rights Act to address inequality, to outlaw discrimination on the basis of race, color, religion, gender, or national origin. He recognized that we had an obligation to advance equality among nations around the world, but also here in our own land. Always a champion of these principles, he said, "If a free society cannot help the many who are poor, it cannot save the few who are rich." And he famously also said, "Ask not what your country can do for you, but what you can do for your country." I've always tried to live by these words and do my part to continue working towards what the Founding Fathers called a more perfect union, or what Martin Luther King called the beloved community. So, in this moment of growing gaps between rich and poor, black and white, Muslim and Christian, let us remember the awesome opportunity and responsibility that we have chosen. In the never-ending struggle for justice, fairness, and equity, advancing health can be one of the most powerful tools we have. So, my dear graduates, if you can maintain the will to pursue that highest ambition, I believe we can all meet the greatest challenges of our time and leave a legacy of healthy populations and health equity for generations to come. So, let's go do it. Congratulations to the master's degree recipients of the Icahn School of Medicine. Thank you very much.